dental podcast
where real people,
real stories,
and real life come together.
This is the Life and Dentistry podcast.
Hello, everyone, and welcome back to another episode of the Life and Dentistry podcast.
What's going on, everybody?
What's up, everybody?
Hey there, boys and girls.
I feel like
Joe,
I should say howdy.
What are you wearing, man?
Hey,
Yeah.
y'all got my cowboy hat? I had to go feed the cows tonight.
So you're a dentist by day and a cowboy by night, huh?
Yeah. They call me the cowboy dentist.
Eating them fresh steaks.
Those were good. Straight from the field.
They look good. They look real good.
It's called the Big Joe diet. Boys, I've been on a diet for about 3 days. And it wore me
How's it
out.
going?
I had to splurge tonight because it was taking a toll on me.
Okay.
He's been on a diet for 3 days and he's gained 50 pounds.
Poor Joe, man. Bless his heart. 3 days,
Dude,
man.
it was so bad. I actually ate cottage cheese the other day for lunch.
Oh, man.
You sound like Scotty now.
Yeah.
Those pictures you sent us had like 20-ounce steaks. You said you had like 3 of those. So I know that's a good diet right there.
Yeah, I got it's pretty bad.
Dang, Joe, you need to watch that documentary, What the Health.
Oh, man. Oh, my gosh.
believe
That thing has scarred me.
That's still freaking me out.
It's like you can't eat nothing. I mean, besides just
No,
grass.
that messed me up.
I'm drinking almond milk now.
I don't know how you drink that stuff,
I haven't
man.
watched that.
It's not that bad. It's really not that bad.
No.
It's really not that
How
bad.
y'all been this week? I've not really talked to anybody.
Oh, been pretty good.
Trying to survive.
You seeing more patients down there in Waycross?
Life as a new dentist.
What's
Yeah,
the
no, I've been seeing patients pretty regular this week. So it's my first actual week where I'm seeing my own patients and all. So it's been good.
Do you have like a
This
full schedule?
morning was a little aggravating.
What's your
Yeah. What
Go
is it, Joe?
what's your schedule like? Do they make it for you?
No, what was it?
Shut that dog up.
Yeah. Basically, we have an office. What's that?
Somebody's dog was barking in the background. Go ahead.
Oh, my internet connection is unstable. That's what it's saying.
No, we can hear you. Tell us about your schedule.
Yeah, that was Big D. D, shut up. No,
D is
but
Scotty's,
the way it's set up. No, we have an office manager, and like I said, the dentist that I went in with, he I've talked before, he bought out another dentist that's retired now due to health reasons, his practice.
Yeah.
And we're still having new patients every week come in from them. So the dentist that I'm working for, since he's been here for 30-something years, a lot of his older patients want to see him, but a lot of the new patients, they've never seen him before either, so they're okay with seeing me. So they've just been slowly adding those patients to my schedule. So that's kind of how it's working.
New patient, or is it like they got scheduled treatment already?
Yeah, a lot of them got scheduled treatment. I've seen a few with that are new patients, and I'll be getting more. I think I got a few more next week, but a lot of them already have scheduled treatments. So I'll just come in, verify it, and do whatever's needed.
You feel like speed wise, you're kind of staying up to par, or is it like kind of slow? Like, are you slower than you want to be?
No, are you talking about business wise or like my actual hand skill speed?
More like clinical hand skill wise. We know you're slow in other things.
Clinical hand skill compared to the two docs that I'm working with.
Yeah.
What am I frozen?
No, you're good.
Can you hear me?
Yeah, we can hear you, bud.
Yeah.
Y'all started laughing like you couldn't hear me or something.
No, you're in.
No, 'cause Joe
that's
said you're
something that's something that I've had to adjust to because I mean, when you're in a practice with two dentists that's been doing it for over 30 years apiece, it's you know, yeah, I'm definitely slower than those guys. So that's a hard pill I've had to swallow, but it's something that, you know, it's just going to take time to build up that speed.
Like today, I thought I was really busy, and I feel like I never sat down. I didn't really even get to check hygiene a lot. The other doc was doing it, and at the end of the day, I'm like, man, I killed it today. And the other doctor produced like 4 times as much as I did, and I'm sitting here, I was like sweating. I thought I did a lot of work. I'm like, I didn't do nothing.
Yeah.
So, Joe, you actually have
felt
access
the same way.
what your production is and what the other doctor's productions is at the end of the day? Like, does your office set goals? Like, how do they do that?
Dude, yes, it's actually really cool. So there's 3 docs and 5 hygienists, and at the end of the day, they print out this day sheet, and it's got everybody's numbers, even hygiene, all the docs. So we know what everyone does, what the office does. Everybody knows, and you go in through and check it, actually kind of double check, you know, what you did is right. It's actually really cool to see those numbers.
That's a good feeling, ain't it?
Cool.
Man? When you can see like,
yeah, it's discouraging when you're seeing everybody else and you're like, you are slow as sin.
yeah, but at least you're producing something, though.
Yeah, no, it's
You
true.
know, I mean,
no, it is a good feeling. It's kind of cool. Do you get to see the numbers and everything too, John Wesley?
Well, we don't really do a daily thing, you know, like it's not like necessarily posted or like, but we do have access to look at that and check it. And every time I get I get paid bi-weekly, and so every time I get a check, I get like a little I'll get a production sheet with that's the software prints off, so I can see like exactly what procedures, what percentage it falls in. So like, you know, out of 100, kind of what my whole production came from, and kind of breaks it down pretty good. So I do get to see that, and I can look at
Do you have a guarantee, John Wesley, for a certain part of your contract, or is it right off the bat like some of us have a deal already where there is no guarantee, it's just a percentage of collections?
Yeah, the way we do it is we do the percentage of collections or production. And
so you do production, right, John Wesley?
Yeah, we do production, but I don't have like a guarantee necessarily, like a base, you know, that I would get every day.
Right.
But in hindsight of that, like, I'm getting all that I can handle. Like the doctor there is giving me, like, I'm pretty much checking as much hygiene as I can handle, and I'm getting as many patients as I can handle. Like, so technically I'm meeting the minimum, then some. So like, it's not like, you know what I'm saying? Like, it's, but the situation is different too, because we're looking at buying the practice. So it's not like it's, you know, there's a pretty big gap in the experience level. So he's kind of on the back end getting ready to, you know, slow down, whereas I'm kind of picking up at the practice. So, you know, he's not, I guess, trying to continue his thing as much. Does that make sense? Like, you know,
so he's feeding you the opportunity that you need, and it's basically up to you to make it work. It's not like you're in a situation where you're struggling to get what you need because you need to make ends meet.
Exactly. Yeah. Exactly.
Right.
Exactly. Yeah.
That's pretty cool. John Wesley and Scotty, how are y'all doing, like, clinically, when you know, like, hygiene's waiting on you, or you know you got another patient? Like, let's say you got that 1 hour slot for like 3 fillings, and they're all like a class 2, and you, like, what do you do when you're done and it's like, well, the filling's in there, there's not really a void, but like, it's not like the most perfect thing I've ever seen. Like, do you feel like you've had to compromise some, maybe on a few things to get it done?
See, that was part of my frustration this morning, you know.
What was it?
No, just like I had like 4 or 5 fillings I was supposed to get completed in like an hour this morning.
Yeah.
And the first one turns into, I think it was like an MO, but it turned into an MODB. It was bombed out, close to the pulp and all this. So it slowed me up on that. And by the time I got finished with that one, I was able to knock out 2 more, but I still wasn't able to complete all of them, what we had initially expected to get done. And I still wound up being about 15 minutes past what I was supposed to be. So it was just, the day started out kind of frustrating that way. And then my second patient, supposed to be a build up and a crown, and it turned into endo, which from the x-ray, I had a pretty good idea that was going to happen, but it
What'd
did.
You do?
So
open it up, or
wound up, we got backed up with that. So I didn't even fully complete the endo. I got everything, all the canals cleaned out and working links and all that, but I still got to have her come back to obturate and still build up and cut the crown. I opened it up, got the working links, cleaned it out with all my rotary files, and then I just put calcium hydroxide in there and closed it up, and then just put a temporary in it.
Dude, this afternoon,
it was just kind of one of those frustrating mornings when nothing goes as planned, which I know we're going to have days. That's dentistry,
and you're on a time crunch.
Well, I'll say this about the time crunch.
Yeah, and that's the thing too. And at the same time, I have like 2 hygienists saying, "Hey, I'm ready for a check," and all this,
And then I start thinking, I feel bad because I think we would be time crunch too, and it's like they've only got a certain amount of time for their patient, and then now I'm taking up.
Yeah, because they're fully booked all day at my practice. And because of me being late on that first one, I was kind of late on all my other patients, and then I wound up like my assistant and some of the hygienists had to shorten their lunch a little bit, so it just made me feel bad.
I know. My assistant had to stay over till like 5:30 today because I popped 2 teeth in a row. 2 different patients, I popped them. It's like, what are the chances?
Yeah. And then at the same time, like in my mind, I'm like, well, I wonder what these assistants and hygienists are thinking about me, and like the dentist that hired me, I hope he's not thinking I'm like incompetent and like, man, this guy's slow as all get out,
Yeah, but they know
so it's just a lot of mind
game
stuff like
they know you're new.
Oh, I know, and they tell me that, but I've always been hard on myself when it comes to stuff like that,
Going back to what you were saying,
I
Joe,
feel
about
like
the
that
time
gets
frame,
better after week 3. Scotty, when you're talking about the mind games, I feel like after 3 weeks, I feel like that was a for me. I don't know how, like Joe and John, how you guys felt. Like the mind games kind of stopped, and you're getting in there. You know that you can be confident, and you don't have to feel like you have to prove yourselves to the assistants.
It's like a football game, boys. It's like you get in there, you can get rattled
every now and then.
That first season,
they know some stuff.
Fourth quarter, you know what you're doing. You got to get in there. We were trained really well at UK. Clinically, I feel like we're trained top notch.
Yeah.
We know what we're doing. You got to get in there and be good. Yeah. What were you saying, John Wesley?
And
no, I was just saying, you're talking about the quality and the quantity, kind of balancing when you've got, let's say you've got, a couple of restorations and you've got hygiene waiting and you've got another patient that's kind of, they're booking it where they're kind of overlapping your schedule. So you're working 2 chairs. Like I think we'd be lying, if I know I would be lying if I didn't say I didn't feel that pressure and that like anxiety feeling like, okay, I'm done with the prep. We've cleaned the decay out, but I took a little bit longer to clean out because maybe, like Scotty said, it was deeper. It was bigger than I thought. And, ethically, you got to do that. You don't, that's just, we all know that. But what that does is that takes your time over. So now the allotted time you had is actually less to do that, do the filling part. And so, like, I'd be lying if I didn't feel that stress, that just, it's like a hot feeling you get, like I'll take it. And I've got a habit of when I get done doing the preps, like I'll look over at the computer and look at the clock. I'll say, okay, this is the time I started and this is what time it is now. I'm like, okay, so I'm either where I need to be or I'm not. And, you know, I think if you don't watch it, it's actually kind of easy if you're not careful to actually lower the quality, you know, like, I mean, it's, and I can see that because I know we've seen a lot of pictures through school and through different social media aspects of where we'll see images of either x-rays or clinical photos. Like, man, who would do that kind of work, you know? But we're always told, like, you know, don't judge because you don't know the situation.
Exactly.
And I mean, I can understand how when you've got the pressure of, you've got to maintain your quality, but you've also got to schedule it right, you know, because if you don't, that's where your quality will go down. Because
and I don't know about y'all too. It's
go ahead.
No, I was just going to say, to add on to that, you know, it's like I'm obviously, you know, I'm doing my very best, but, you know, you're on a faster pace too, because you are on a schedule. And even though it looks good and all that, and I don't see any voids on the composites and all, I find myself like I rushed through it. Like I went through it a lot faster than you had to deal with in school. I'm having to get used to that mindset because once the patient leaves, I'm like stressing out, like, man, I hope that composite doesn't fall out or something like that, you know.
I hope they can floss that.
And like, I'm like, man, I hope this afternoon they don't call and say that.
I'm just kidding.
To what?
I know people listen to this. I'm just joking about that. They can floss all the time.
No, it's just a lot of mind games. I think that's the biggest thing. It's just, you know, getting that confidence.
That's all it is, buddy.
In the real world.
Hey, I want to add something to that. That's actually a good point you brought this up, Joe. Something that Dr. Andy kind of mentioned to me about. So something that I was real bad about when the first couple of weeks that I was there, I would put the topical in and I would really like let it sit. You know, like in my head, I'm like really letting it sit on there and I'm talking to the patient, you know, and all that, because that's just, you know, I'm new and I feel like I have to do that. The topical, though, doesn't have to be there as long. Like the effects start quicker than you think. You know what I'm saying? Like it doesn't take 6-7 minutes. Like it might take 3 minutes, you know. But the point he made was I was doing that on every patient pretty much, okay? And so what I'm getting at is when you have a super tight schedule and certain things, that's just an example, but this goes to any kind of type of movement you do. If you can save 3 or 4 minutes, still do the same quality, the same level, but save 3 or 4 minutes here or there, that only opens you up. Like it may be only 4 minutes right now, but if you take an 8-hour day, I mean, that's like another patient. I mean, that's another time slot, you know, but that frees you up more for checking hygiene and stuff like that. So I've started to be real more conscious of how I'm like, how quickly I'm kind of grabbing things, how I'm moving with the assistants, how I'm, you know, like my movements, I'm really trying to calculate, okay, let's be more crisp here and crisp here. And it makes a difference. It really does. Yeah, it really does.
Something that helps a lot with the learning is having a good team, like a good team, a good system in the office. Like I literally, that office could run without a doctor there. I mean, those girls know what's going on. Like that, to me, that's something as like the owner of that practice, Dr. Bryant, he should be proud of that. He's like made that system to where it is a smooth sailing system. The girls are awesome. Like they can do everything. Like they tell me what to do. Like there's been so many times where I didn't know where I was supposed to go or what to use here, and they know exactly what to do. That is,
You bring up a good point. You bring up a good point there as far as the team. I have a question for y'all though, because I think my situation is very different than y'all's. As far as mentorship from the doctors that you guys are with, I know one of the biggest things coming out of school for us as young dentists is we have all these big dreams and these big goals and ideas about how we want to treat and the things we want to do. And one of the things we really want to get into is a situation where we have a doctor who can mentor us and kind of guide us as we grow and learn and understand dentistry. Like, do you guys feel like you're in a position to where if something comes up, you can go and talk to a dentist, the owner, and y'all can just, talk dentistry and he can teach you, and you just don't feel like you're being judged, like you're being mentored, like a pupil, What's y'all's
I definitely
situation?
Do. Both of the dentists that.
Go ahead, Scotty.
Who wants to go first?
Go ahead, Scotty.
Go ahead.
Yeah, well, like I said, I'm in with two established dentists that's been working for over 30 plus years apiece, and of course, one has been my dentist my whole life, and he's like if I had a second dad, that's who he'd be. And then the doctor that owns the practice originally, that still owns it, but that I went in with, he's awesome too, and they're all for just taking time to really mentor me, and they're always open to any questions that I have. And if I want a second set of eyes, if I'm doing something, they're more than willing to to take time to come in. I mean, that was one thing when I was interviewing that I made sure he was going to be okay with. I just didn't want to be left out to dry if I come across something I'd never seen in dental school before. And he and both of them, they're part of their passion is actually teaching and mentoring. So I feel really blessed to be in the practice I'm in. Plus, I got a great team there too that's really helped me out so far.
That's great, man.
Kind of same for me, man. There's two dentists with us. I've said on here before, and it's cool because there's two different generations of dentists, and they're Dr. Brown. He's like a really like kind of I don't know what the good term for, like progressive, like wants to do like all the new stuff in dentistry and keep up with all the technology and stuff. He's got the same morals.
That's great.
He's a Christian, which I am. So we talk about that kind of stuff. He's really, I feel like I can bond with him, which is kind of cool to be able to bond with somebody.
I feel the same way, Joe.
Same with Dr. Brown.
I feel the same way.
Awesome. Yeah. It's a blessing, really.
Yeah. Like as far as the mentorship, I think in my situation, anytime that I've ever needed, I'm going to say mentorship, but it's like help is probably a more accurate term for me to use. Anytime I've needed help, like that, something comes up in the office, there's a situation, a patient that I just have no idea what's wrong with them, or, how would, I don't know how to handle the situation. He's been 100%, anytime I need it, he'll drop what he's doing, pause, put himself behind to help me out. So that's been huge for me, because I mean, I said it, I think I've said it on the last couple of episodes, every week, I mean, there's at least 2 patients that come in that the treatment could go 3 different ways, and I think I know what's right. And that confidence is getting better, but I want to know what he thinks, I just want to know how he would handle it. But the flip side of that is like the practice is, it's fairly busy. And so my schedule was booked kind of, when I was able to start, it was kind of early on, it was busy. So was his. So the flip side of that is, we don't get as much time kind of set aside to do the mentor. Does that make sense? Like I can't say anything bad, but just to be real about it. I mean, that's just kind of the situation, like if we have to do some kind of discussion about something, it's going to be like after hours or something, instead of, what I'm saying, like kind of during the day, like it's just kind of, because it's so busy there. So
what about you, Lewis? Why do you ask? I mean, what are you thinking?
I ask because I feel like I'm more of in a situation where I kind of feel like I'm on my own a little bit. The doctor just kind of, and we're not doing as many things as you guys. We're just doing a bunch of extractions and we're just doing a lot of impressions. But I just feel like so far my mentors have been just Carl Misch and Justin Moody, because in my free time I've just been reading their books. My doctor just kind of likes
great mentors
to keep to himself mostly. It's just his personality, and so kind of things I've been having to deal with more just on my own. I had to take that book with me to the office, the one about dealing with medically compromised patients, because every patient that walks in to get their teeth taken out have all kinds of diseases and illnesses, and so I'm the one who's pulling the teeth, and so I have to make sure that. But I asked because I wanted to know what that's like for you guys, because I don't feel like I can bounce any ideas, and I kind of feel like I don't know, I'm kind of navigating my own way, and I don't know.
But see, in a sense,
yeah,
it's like I think there's pros and cons to everyone's situation. Because in a sense, I'm kind of envious a little bit on you being able to pave your own path. Like my path, the path I've taken is amazing, but it is almost paved. It almost paved for me. I don't get to do any paving, and I think there's something to be said to be able to look back and say I made this. Like I did this for myself.
Yeah.
You're at that office, Lewis, long term, or if you go to another office, it's like you learn more.
Right.
You learn by doing, not learning to do. And that's kind of what you're doing now. You're learning by doing.
Yeah, I agree, Joe.
It's just it's nice to have somebody who's got that wisdom from all their years of experience. And,
so what do you do in the situation where
that.
So like, okay, you said, a lot of the medically compromised patients, I'm sure you're probably dealing with a ton, like.
Yeah, I had a situation this week.
Like, and so for an example, like this week I had a situation where a patient came in and they had just recently, within a month, had a pretty major stroke. And, it's a pretty big deal. Kind of lost some of the ability to walk, had to relearn some of that stuff, and had a tooth broke off. Okay. And the tooth, I looked at everything, and obviously, like, diagnosing wise, no pain. It needs a crown. Like, it's broke off pretty bad. Like, it needs a crown on it. So that part was simple. But like the medically compromised side, I'm like, that was just a month ago. Probably the last thing I need to be doing is giving this patient any kind of anesthetic because the situation was so severe. So what I did was I went and talked with Dr. Andy, kind of, hey, this, what do you think about this, and how long, what's your thought process on this? Okay. So in that kind of situation for you, are you able to do that same thing? Or like you were saying, are you just having to just kind of make your own? Does that make sense? Like if you've got a question, if you've got.
Yeah. If I have a question, I can go and ask him, but a lot of things they've changed just because of research and things we've learned in school that maybe somebody who's older, they don't really know the newer protocol for such things.
Right. Yeah.
And so you have to kind of take it upon yourself because you're responsible for that patient, and so my concerns usually are things like, is this patient taking a lot of anticoagulants or blood thinners like aspirin, Eliquis and Plavix, warfarin, all these things I need to ask them. And if they are, then I tell them, like, what we're going to need is an okay from your doctor. I need you to be off of this for this many days, and they need to okay it first, and then they have to have that faxed over to us so we can go ahead and do that. And there's not that many things that a patient comes with to the office that you can't treat them. Like there's only a handful of things, and once you figure out what those are,
they scare the crap out of you. But really, you can treat a lot of stuff.
You really can, as long as you ask the right questions and you know what those questions are, you're ready. Say a situation does occur. So I had a patient who came in. He was an older guy who was on a wheelchair, and I think he was in his 80s, and he was on Eliquis and aspirin, and he needed a full mouth extraction, was getting, immediate dentures that day. And we did the impressions, and I had to talk to him and his son. I said, look, we can't do this today. We're going to need you to, be off the Eliquis for a couple of days. We need to get the okay from your doctor first. And anyways, he goes, gets the okay from the doctor. We get faxed. I do the surgery, no problems. And then he comes in a few days later that he had a couple of like bloody plugs, like globules in a couple of sockets in the maxilla, just kind of sitting there. And his daughter was kind of she was worried, said he's been bleeding a little bit. And I took a look at it and made sure everything was okay. He wasn't bleeding at that time. And I told him, like, just don't wear the dentures for a couple of days. Just try to heal up, drink a lot of fluids, and anyways, I get a phone call from his daughter a few days later about how he's in the hospital because he's still bleeding, and he's been in the hospital for several days. And it's just a weird situation to be in because, they're calling me like, what can we do? And, after the extractions, he went right back on to the Eliquis and all the other medications. And so I really don't have any power to take him off or tell him to be taking thrombin or something else that would clot because he has other issues. He's older. And so they're calling me from the hospital, and I'm just in this situation where I kind of wanted the doctor to kind of help me out in, but it was kind of all on me. And it's okay because it's a learning situation for me. But
wow,
you just talk to the patients and let them know that you care, and you tell them what you know, and you just check in on them. There's nothing I can do. I did everything right, but unfortunately he's in the hospital and he's older, so there's lots of factors going on with him. So that's my situation that I had this week.
Wow, buddy. How's he doing? So, now, like today.
He's doing good. He's in the hospital. It's been a few days he's been in there, so
you gonna go see him?
It's not fun for him. Am I gonna go see him? Maybe.
What do you do, man?
He was a cool guy. I liked him a lot. He called me Louie. So me and him, we were
Louie. You're fixing to take a trip, Big Louie. Where you going, man? Tell it.
Yeah, man. I am going to Phoenix, Arizona, Implant Pathway. Getting ready to take session 4 of Dr. Moody and Dr. Fryman's course.
Mood.
So I'm excited about that.
Man, I'm jealous, man.
That's
I'm
awesome.
Jealous.
Aren't you going too, Joe?
No. That's just Lou by himself.
Okay.
I'm not signed up for session 4.
Okay. I thought you were saying you were going.
This part right here is probably one of the biggest reasons why I took on my job with Affordable Dentures. They pay for their doctors to do this, and this is a huge thing that Dr. Moody is doing, where we get to go into a clinic where there's some veterans and homeless people and homeless veterans, and we get to provide dental care for them at no cost to them, and we're just placing a whole bunch of implants.
Lou, what's your goal for dropping screws down there at session 4? How many do you want to place?
My goal is to drop 60. Dr. Moody said that it ranges for some people. Some people can drop 20, 30, 40, 50. I'm going in there just ready to roll.
It's a lot of screws.
You guys know that I love to do this.
60.
I know, but I'm excited.
So when you do the session 4,
awesome.
you can actually, you actually get to place 20 to 30. It's like is that a?
Yeah. It's pretty fair to say that you'll get to place at least 20 to 30.
Dude, if I went to a single, it's like a weekend, right? Isn't that right?
Yeah. So it starts on the 2nd and it goes to the 5th. So it's actually Wednesday, Thursday, Friday, and Saturday.
Dude, if I place 30,
but you're in there all day.
Yeah, if I place 30 implants,
that's awesome.
If I place 30 implants in 3 days, I guarantee I'm coming back ready to place implants. I mean,
oh yeah, definitely.
I mean, that's like
Moody's course.
I'm just ready for session 2 and 3.
The cool thing,
they're like going to be one of the biggest implants.
Yeah, you got to get the basics
in the country.
Mm-hmm.
Like they're big time.
It definitely feels like it is, and you guys know that I'm all about this. I look into several courses. You got the Maxi course, the Mish course. You got some implant institute in California. You got the McCracken course. You got all kinds of courses. I don't think any of them get as in depth as you will on this course. And I'll be taking my GoPro with me. I'm gonna just kind of record this whole voyage.
Ooh, that'd be good.
Like from the moment I get to the airport.
Yeah, definitely.
To like my whole time there, and I'll put together a good YouTube video for us to just kind of share and kind of see what I experience. So I'll keep that posted.
It'd be awesome.
Yeah, it'll be on our YouTube channel for sure. But I'm excited, not just because you're placing the implants, because there are some courses where you fly out to Mexico or Honduras and you get to place a lot of implants. In Moody's course, you actually get to restore and do the actual prosthetic side of things, so that when you're placing implants, you know where they should be going in reference to the prosthesis, and it just allows you to kind of work backwards and get to see how that works, because when you come back to your office, you got to know how everything works.
Yeah, I'm excited for you to go down. Excited. Can't wait to take mine.
Yeah, I can't wait.
Yeah, I can't wait to.
John Wesley, do you have a GoPro?
No, man, that's on the next. That's the next thing on my list to buy.
That'd be cool if we had one when we go to San Francisco for the session 2 and 3, just to kind of take videos
mine
here and there.
It's a good idea.
Yeah, if I don't have one, we might look into yours, Lou.
Yeah. So for our listeners, if you guys
get you a drone too
already, we're fixing to come out every week. We're putting these episodes we're doing on our YouTube channel. And we're also going to be adding stuff like our day-to-day life. Lou's heading up to YouTube. We're going to make some videos. Here in the coming months, we're going to do a little day in the life of. So we'll kind of follow one of us around for a day, go through what it's like to be a Blanchard or a Halliburton for a day. Guys, the inside scoop.
Yeah.
So it's something to watch out for. We also got some big news coming with a website, the Life and Dentistry podcast website. We're going to have links on there to some resources that we use that are beneficial to us, things that have helped us. You're going to have all of our contact information because we love to help others. We love to – what little bit of knowledge we do have combined with the 7 or 6 or however many of us there are, we'd love to share it with everyone else. So for sure, go.
And the growing knowledge day by day.
Yeah, we're getting more knowledge each day.
Every day. Y'all are all you listeners out there, you're taking the ride with us. So
let me ask y'all,
you're learning as we're learning.
Let me ask y'all this. So pretty much every week for me, something happens to where I don't want to say the word that I look stupid, but it's some kind of there's a moment to where it's like it's funny in hindsight. Have you guys had anything so far, like up to this point, like you're like, oh my gosh, did that really happen? Like did I really say that, or did I really do that?
Yeah.
A lady today asked me about TMJ, something about TMJ and if it can cause pain somewhere else. And I'm like, well, you ask a really weird question. The way I said it made it sound like I was calling her weird. So she looked at me and she's like laying in the chair and I was backing her out and she goes like this. Like she's kind of mad that I said it was a weird question. Like, moron. Like, oh.
That's pretty bad, man. I'm not gonna lie.
I was like, that's a really weird question. Then I said it like that. It's all about how you say it. I'm like,
yeah.
I'm like, just go see Dr. John Wesley. He's better than me.
Oh gosh. What about you, Scotty?
Yeah, I've had a few. The other day I had an 8-year-old kid in my chair, and she's got some kind of intrinsic stain. I think it's like where some enamel didn't form or something. And the mom was in there asking about how can we get rid of it or whatever. And I was like, well, it's I don't really know, but it shouldn't affect the permanent tooth or anything. And then she pauses for a second, and she's like, that is her permanent tooth. I'm like, oh, shit. I'm like, yeah, never mind. She's 8 years old. Man, I know I probably turned so red. I'm like, oh, and then I tried to play it off, and it was embarrassing. Golly. I walked out and I just banged my head in the wall. It's like, golly.
I'm glad I don't have to see kids. Tori comes in and tells me those kind of stories too.
I tell you what, that's the hardest thing for me because we didn't see a lot of kids on a regular basis in school, and just dealing with mixed dentition is so hard for me for some reason. I don't know. It is.
Well, we didn't see it enough.
Oh, so that was embarrassing.
Yeah.
What about you? What are your stories?
Me?
Yeah.
I've had a couple. I don't know. I guess so. In our office, we have Pandora playing. So every other day, somebody gets to choose their station that they get to play, right?
Yeah.
And so
washed out.
I'm in Cookeville, Tennessee, right? But our doctor hates country music. So all the country assistants are not allowed to play country music. So anyways, one day they're like, hey, Dr. Lewis, you want to pick the radio station? And I'm like, nah, it's all right. Y'all go ahead and do it. Y'all won't like my stuff. They're like, what kind of stuff do you like?
Smooth jazz.
Oh, yeah. Well, yeah, they don't want anything that puts them to sleep. So I go, y'all like house music, some tropical house? And they're like, what in the world is that? So I put it on, and they're not feeling it. And so I'm feeling it. Meanwhile, man, I'm in the zone, taking teeth out, just Kygo all day. I feel like I'm on the beach, just taking teeth out, and they're just not.
Oh, that would have been great.
Dude, that's hilarious.
What about you?
Well, that's hilarious, man. You bring up the Pandora stuff for like the station, because our office does the same thing. Like it's it's just Pandora. It's like the internet. There's a box. It's actually a nice little box. And so, they've liked so many songs that it's kind of like what Scotty has. You've got so many backlog songs they just play over and over again on your station. So these songs, like no one picks it. They play over and over again. But the thing is, it's like a lot of the same stuff. Like the same songs will come on. So like what's so funny is when I got to this practice, a lot of these songs are songs that I'd never heard before. I mean, it varies from country, some rock, some Christian music. I mean, it's all kinds of stuff. But some of the songs I'd never heard before. And they play so much that as soon as the first like beat comes on, like I sing to myself. Like, but it's so funny because I never heard the song before.
Yeah.
But it's the same stuff that comes on, the same, like it kind of rolls through again. I'm like, we need to add a few extras in here somewhere.
It's interesting when a song that you like or the music that you like that gets you in the zone, when it starts playing, like you're 10 times a better dentist, like immediately, because the music sounds good.
Yeah, man.
You're just in the zone.
That's why you see LJ warming up with them Beats headphones.
Oh yeah, definitely.
Could you imagine coming into the room with your patient and you've got like Beats headphones on? You just like sit down, lean them back, and just start working.
Michael Phelps, like take off your coat, sit down, get ready, put your gloves on.
Penguin flap.
Man. That's the only downside I can say about the practice is the music that's played. Because it's just a lot of classical instrumental stuff. I'm just like,
is it that elevator music?
I like elevator music. This is more just like straight classical stuff, like I'm like, oh man,
a little Beethoven.
Scotty's like frolicking through the office.
Little Beethoven, a little Mozart. And none of the assistants like the music either, but the head dentist, that's what he likes, so that's what they play.
I can see you just working on a patient. You're just like sitting there drilling. You're like your burrs moving to the music, like it's an orchestra.
So if I could, I'd definitely change the music.
It's pretty clear then that the number one reason to own your own dental office is so you can pick your own
own music.
Exactly.
Yes. We're gonna title the episode "How to Choose the Music for the Dental Office."
Oh man.
Oh gosh, guys, I got one question I do want to ask everybody, and let's be honest, okay? I think a lot of people would kind of like to hear this. So at this stage of their game right now, we're kind of early on. We've been working in offices, ranging from 3, 4, 5, 6 weeks, So we've kind of got a pretty good taste of dentistry in the real world, whether it be whatever situation you're in. Do y'all regret going in this field, or do you think this is maybe one of the best choices we could have made?
Oh, this is the best choice we could have made, man. It's a good field.
Oh yeah, definitely the best.
I love this job.
The best. I'm ready to get to that point where I'm like just super confident in everything I do, I think part of that too is just because everything in the office is just completely different equipment than I've used, different instruments and stuff, and different materials. And I'm slowly, I've gotten a lot more comfortable with that. So I'd say another week or two, I should be, even better. But I think back to what I could be doing right now, or what I was going to do if I never got into dental school. And I just thank God every day for this blessing. What's that?
What was it? What would you be doing right now, Scotty Blanchard?
Chicken.
I'd be working in a chicken farm right now. Sanders Chicken Farm. I was going to be a supervisor on the assembly line there.
So pretty much what you're saying is all those late nights studying path, all those hours put in the pre-clinicals, all that stuff was worth it, right?
Too soon, John. Too soon.
It's definitely worth it. It's worth it.
One of these episodes remind me, and I want to tell the audience about me and Scotty's first day in the sim lab. Not tonight. We don't have enough.
Yeah. We'll save that for next time.
That'll be next time. Yeah.
Oh man.
Oh, gosh.
Well, guys, thanks again for tuning in this week. Hope you guys enjoyed it. We're having a blast doing these episodes. We'll keep doing it. If we have one download a week, that's we'll stop at 0. So
I'm always going to listen.
That's right.
Yeah, exactly. So
she
we'll never stop. Oh man.
Can I add one more thing? One more thing you mentioned about having any regrets, and I was thinking about this earlier today.
Yeah.
Not so much any regrets about being in the field, but more about thinking if I could go in a different direction, would I have? Have you guys thought about that?
No. What as in? Well, like
as in like if you could do it again, like you're in your last year of dental school, and you're in this situation now. Yeah, like and you're deciding, all right, I want to go here. This is where I'm going to move my family. I have these opportunities. This is the opportunity I'm going to select, because I know all of us had a handful of different opportunities. And so sometimes in my mind, I'm thinking like what it would have been like if I would have went with my other choice. Where would I have been? What would I have been doing now? Like, do you guys have those kinds of thoughts?
That's life, man. That's the grass is greener on the other side all the time.
Well, not necessarily the grass is greener, but just more along the lines
I couldn't have picked anything better. It's just I hated leaving all you guys because all y'all are in Tennessee. I'd probably say that's probably the hardest thing was just moving back. But from a business standpoint and being happy in a really good practice with a great opportunity for the future, I couldn't have picked anything better.
Awesome.
I agree.
So,
all right, guys. Well, like I said, man, thanks everybody for tuning in. We'll we'll keep doing this as long as you guys want us to, and as long as we have internet and computers and microphones. We'll
don't get satellite internet.
Yeah, stay away from the satellite.
Yeah, don't do it. Don't do it.
Yeah, everybody. Don't forget to follow our journey through life and dentistry on social media. You can find us on Facebook and Instagram at Life and Dentistry, and on Twitter at Life and Dent. If you have any questions, you can send us an email to lifeanddentistry@gmail.com. And if you haven't done already, be sure to head over to our reviews and ratings page on iTunes and let us know how we're doing, how we sound, and be sure to hit the subscribe button so you don't miss another episode. Thank you guys for tuning in, and with that, we'll catch you next time.
Take care, guys.
Y'all come back. Good to see you guys.
Everybody.
Thank y'all for coming tonight.
The Dental Podcast, where real people, real stories, and real life come together.
This is the Life and Dentistry Podcast.